there are alarm bells ringing in the national capital as well, and that's of course our next big focus. All right, as far as Delhi is concerned, there is a COVID scare in the national capital. The number of COVID cases are rising exponentially. There have been over 2,000 cases, 2,495 to be precise, 7 deaths which have taken place in Delhi. The positivity rate in Delhi is standing right now at 15.41%. The active cases were at 8,000. Delhi Health Bulletin notified on Tuesday said the same. The national capital saw 1,300 COVID-19 infection, 6 deaths, and the positivity rate at 17.85%. That's the highest since January 2021. This is according to the Delhi Health Bulletin. With fresh infections and fatalities, Delhi's caseload is increasing. It's reached 19,000 plus. The death toll is at 26,000 plus. In fact, there are 9,000 plus beds which have been reserved for COVID-19 patients. Only 534 as of now have been occupied. So the Delhi government says they're fully prepared. They have many beds which are lying vacant. 253 containment zones have already been identified in the city. Now, capital or rather national capital, the cases which it is reporting is of BA.4 and BA.5 subvariant. Now, these are subvariants of Omicron which are highly transmissible but less fatal. But certainly the positivity rate is ringing alarm bells of a different kind far as the national capital is concerned. The number of daily COVID cases in Delhi had touched a record high of 28,867 on January 13 this year. During the third wave of the pandemic, the city had recorded a positivity rate of 30.6% on Jan 14th, the highest during the third wave of the pandemic. All right, we are now being joined by Dr. Anil Arora. He is the head of the gastro department at the Sir Gangaram Hospital. Thank you, sir, for joining us on NewsX. First question, yes, the positivity rate is high. Yes, we need to be cautious. But, sir, should we look at these numbers with a pinch of salt? Because end of the day, even with an exponential positivity rate, the number of cases have been contained to 2,000 plus. Okay, we've lost that line with Professor Arora. We will be joined with him very shortly. But talking about the number of COVID cases, exponential rise in the number of COVID cases. On Tuesday itself, 2,000 plus cases were reported, 2,495 to be precise. 7 deaths have happened in the national capital due to the same. The positivity rate is 15.41%. Active caseload is 8,000 plus. But again, if you look at the number in totality, it is, we'll get an expert to answer this better. But again, is it correct to make an apple-to-apple comparison of the positivity rate? Yes, the positivity rate is high. It had even touched 17%. It's the highest in Jan 2021. But if you look at the peak of third wave figures, they were between 25 to 28,000. So considering, of course, given the numbers which were prevailing earlier, the numbers are much less, but that doesn't mean that we throw caution to the wind. Washing your hands, wearing face masks, and of course, using sanitizers still paramount. All right, Professor Arora is back with us. Morning, sir. Thank you for joining us on NewsX. Sir, the positivity rate is high. It's ringing alarm bells. Rightly so, we all need to be cautious. But would you say that we also need to look at these numbers with a pinch of salt? End of the day, an apple-to-apple comparison of the positivity rate may not be correct if we compare it to the third wave, because in third wave, the numbers were exponentially high.
Yeah, I think, thank you, Meenakshi, for having me on your show. I think it is very important and relevant to remember that you cannot compare the previous Delta wave to the present wave. At that time, we were caught unaware with the guard, and we were not even know what is happening. Today, most of our population is certainly vaccinated against the COVID-19 infection, and those who have not been vaccinated, possibly incidentally or accidentally, would have been exposed to the virus. But the fact remains the virus is smarter than most of us all put together, and it is mutating its way to still enter the host cell. So there will be a certain community of immunocompromised people who will be at risk of developing severe infection, including death, as you have rightly reported. So it is high time, as you very rightly said, we do not throw the caution to the wind. We continue to follow the COVID appropriate behavior, and all those people who have not been revaccinated as per the schedule of the government should go and get vaccinated. And we should still try to minimize the functions in the party. We should try to have maximum social isolation and continue to wear the mask till the WHO or the government of India declares it COVID-free.
Well, absolutely, you rightly said so, sir. Again, end of the day, we're not trying to spread panic here. Yes, Omicron, the fatality rate is low. The government and the hospitals are better prepared. But again, you cannot throw caution to the wind, isn't it, sir?
Yeah, I agree with you. You know, if you think you are lenient and you can be complacent about it, then you are the person who is likely to suffer. What is the point in just throwing off the basic face mask? This is something which prevents you from so many viral illnesses, including the other respiratory tract diseases and the common cold, etc. So if you continue to wear the mask and ward off the crisis of this recurrent COVID wave, because it is a tedious virus, it is a different type of virus which in spite of repeated vaccination is still trying to bring up its ugly head and try to infect people across the board. So those who are at the vulnerable age are likely to come down it. But these people who are at vulnerable age are likely to be infected with the people who may be asymptomatic. Even this figure of 2,600 in Delhi may still be a red herring. I think the number of the cases will be far more than what we have reported, because majority of those with fever and common cold may not be getting tested for COVID.
Correct.
So I think the volume or the total number may be more.
And yes, absolutely, sir. And that is a very pertinent point which you raise, and we'll discuss it later in a different health show. For now, thank you for joining us.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.